did our food service placement at Northeast Health Wangaratta to review the food service system and food quality at Illoura Residential Aged Care.
Riskman reports related to residents receiving incorrectly textured food, the limited variety in meal choices, and lack of gluten-free food options, as well as negative feedback regarding food quality, prompted the need to review the current Illoura food service system. The goal of this review was to develop suggestions for a robust system in which clients receive meals that are compliant with their allocated diet code, are offered choice and variety, and are routinely asked for feedback on their meals. The corresponding objectives are detailed below.
This was an interview and observation-based study that generated both qualitative and quantitative data. The process of data collection is presented on this slide.
Throughout the presentation, we will be referring to the Menu and Mealtime Quality Assessment for Residential Aged Care. This tool, developed by Dietitians Australia, uses the aged care quality standards to assess nutrition care and mealtime experience.
The current system at Illoura involves a 4-week menu cycle with food being cooked and transported from Northeast Health Wangaratta. A detailed description of the current system from menu ordering to plating is outlined in this process map. Mapping this process allowed us to identify issues and potential risks associated with the current process. These risks are highlighted in red. The following slides display process maps of the current management of diet codes and allergens at Illoura. Once again, the identified risk points are highlighted in red. The highlighted risk points from both process maps are summarised in this table below. Errors in communication, a lack of formal documentation, and the management of allergens were recognised as potential risk points.
The overarching recommendation is for Illoura to install an on-site kitchen. This will eliminate majority of the issues identified within the current system, including a lack of meal variety, poor temperature control, inconsistent allergen management, and a lack of meal choice for residents on a texture-modified diet. The outcomes of an on-site kitchen are further explained here. Another recommendation is to implement the use of Chef Max. Chef Max would streamline the process at both Illoura and NHW to ensure consistency and quick access to diet codes, allergens, and preferences. It will also allow for easy menu ordering, while being a system that is straightforward for the relevant staff to update the residents' diet codes, likes, and dislikes. The proposed system using Chef Max is detailed below in this process map. To facilitate the simplicity of Chef Max menu ordering system, it is recommended that an iPad or tablet is used. This will enable menu ordering to be portable and dietary requirements to be updated with ease in both Chef Max and Manon. On this slide is the tool created to screen residents for dietary requirements on arrival. This removes the risk involved with relying on resident memory. Included in this questionnaire is the malnutrition screening tool. This will allow Illoura to easily identify residents requiring dietetic assessment. Verbal feedback from the resident survey identified a considerable lack of gluten-free meal and snack options. The process map also identified a risk of cross-contamination in the current process. To address this, it is suggested that gluten-free meals are sourced from an alternative delivery service. Alternatively, sourcing backup meal options from supermarkets to store in the freezer will provide more variety. The variety and quality of texture-modified meals could be improved by modifying meals at Northeast Health in order to provide more variety and move away from a 1-week menu cycle. Morning and afternoon snacks could also be improved by educating food service staff in the preparation of safe texture-modified foods. Observation of Illoura mealtimes and verbal resident feedback revealed room for improvement in the dining environment. Minor, inexpensive changes to the current dining arrangement can provide a homely feel for residents improve eating and nutritional intake, and the overall social experience. Displayed on this slide are a list of recommendations.
To prevent issues associated with residents receiving incorrectly textured foods, it is recommended that staff receive training and education on the IDSI guidelines. This education could be provided by the dietetics and speech pathology team from North East Health Wangaratta. In order to measure whether the desired outcomes have been achieved, it is recommended that the staff and resident surveys are repeated following the implementation of the recommendations. It is also recommended that regular meetings are held between North East Health Food Service staff, Illoura staff, and North East Health Dietetics team to assess any progress made.